रेकॉर्ड ते केलं ना अटेंडन्स रेकॉर्ड 5 मिनिटं Good morning to everyone. In previous lecture, we have discussed about the introduction part of the renewable partial dangers, and some part we covered about the classification. In today's lecture, we will cover in detail about the classification of the partially dangerous renewable arches, in which we are going to cover the classification, enumerate the requirements of the acceptable classifications, then list system of the classification. We will describe the Kennedy's classification, Applegate's rules in detail. Now, coming to introduction, missing of a natural teeth is considered as a misfortune. It demands immediate replacement by prosthesis to avoid further damage to the remaining components of the masticatory apparatus. And the point is to restore the impaired function of the mastication, including the sticks and frontiers. The areas of missing teeth varies from patient to patient. There are more than 65,000 possible combinations of the partially missing conditions, as stated by the Truman in 1925. Combining both the drug, it will amount to 1,30,000 possible combinations, which will be difficult for any planner to memorize or and implement. Hence, the need for the system of classification was realized by the profession. That means the classification should be systemic in a systemic manner. What are the requirements of the acceptable classification? It should permit the immediate visualization of the type of partially dangerous arches that is being considered. Number second point is differentiate between the nature of the support. It should be simple to understand and it should be acceptable to all. These are the main requirements. The classification. Then, which are systems in which the humor classification is given in 19. Then Kennedy's classification, which is mostly accepted classification, which is given in 1923. Further, Bayesian system is given in 1928. Then Beckett's system in 1953. Then Friedman system in 1953. Then Applegate's Kennedy system come, and then the seventh is Swenson's system and many more. Uh, these are the mainly systems. Just you remember these names: Kumas, Kennedy, Byron, Beckett's, Friedman's, Applegate, and Swenson's. Now, main part is Kennedy's classification. It is described in detail, and it is the mainly at some point of view it's important to study. Kennedy's classification, which is given in 1923, it is universally accepted classification. It satisfies most of the requirements about the classification. Then partially, practically the majority of the situations are classified into the four main classes and easy to remember. This classification is universally accepted. Remember this. So this is most important in our curriculum and it is easy to remember. Coming to class 1. As in previous lecture also we discussed about the this classification in way where we will discuss with the diagrams. Uh, Here bilateral edentulous areas located posterior to the remaining natural teeth. These are the bilateral. Here you can see the cursor on the screen. These are the bilateral edentulous areas located posterior to the remaining natural tooth. Just remember it. Bilateral area, edentulous areas located posterior to the remaining natural tooth. And coming to class 2, unilateral edentulous area. Here you can see unilateral. That is, edentulous area is present only at the one side of the arches. Posterior to remaining natural teeth. That means the anteriorly uh, natural teeth are present here. Then Kennedy's class 3, unilateral edentulous area with the natural teeth remaining anterior and posterior to the edentulous space. Here you can understand this is the unilateral edentulous area with the natural teeth remaining anterior and posterior to it. In this mandibular cast also you can see the anteriorly teeth are present and posterior there is teeth. That's why unilateral edentulous area with natural teeth remaining anterior and posterior to the edentulous space. This is class 3. In class 4, single but bilateral. This is the single area. But bilateral, why it is bilateral? As it crosses the midline. Here also it crosses the midline. That's why single but bilateral edentulous area located anterior to the remaining natural teeth. That means here are posteriorly teeth are present in these arches, edentulous arches. The edentulous face is a single but a bilateral edentulous area located anterior to the remaining natural teeth. Here you can see. Then coming to the modifications of the areas, modification areas. Any additional edentulous face after the main class is termed as the modification and written as the number as per the additional classes. As you can see, this is the Kennedy's class 2. Actually, classification under Kennedy's class 2 comes. That is single bilateral edentulous area. Anterior to it, there are teeth present. And in this class, here you can see one side there is class 2 and here also edentulous space is present. That is why modification 1 is written here. Kennedy is class 2 modification 1. That is the any additional edentulous space. Any additional edentulous space when present there you can give it name as a modification 1. It's termed as a modification and written as a number as per the additional spaces. As in this classification you can see two spaces are seen here. That's why Kennedy's class 2 modification 2. Same cast is here. You can see here two spaces are additional spaces are here. That's why modification 2. In this diagram here you can see one edentulous space is there. That's why modification 1. Applegate's rule governing the classification is a main important Applegate's rules are given for the Kennedy's classification. You should remember, and the question may comes in exam as a write down the Applegate's rule. That's why it is the main important part. Here, rule 1 is the classification should follow rather than precede any extraction. That means we should plan treatment of extraction first, and after that we should plan the classification and treatment of the individual partial arches. That's why the classification should follow rather than precede. Means extraction, it should be classification should be after the extraction of the needed root. Then rule 2 is that if third molar is missing, here you can see if third molar is missing and not to be replaced, if it's not to be replaced, then it is not considered in the classification. Then rule 3, if third molar is present and is to be used as the abutment, then it is considered in the classification. If third molar is present here, you can see, and is to be used as an abutment, and is to be used as an abutment, then it is considered in the classification. This is rule 3. And rule 4, if second molar is missing, here you can see the cross marking is there. If second molar is missing and is not to be replaced, then it is not considered in the classification. This is rule 4. Then rule 5, which is the most important rule. in the classification. That is, most posterior edentulous area always determines the classification. Here you can see in this diagram, this is a, suppose this is a edentulous area, then it is most posterior edentulous area. That's why it determines the classification. Not this one. This is also the edentulous space, but this will come as a modification. But this will determine the main classification. That is Kennedy's class 2, and this comes as a modification. That is one edentulous area is there. That's why it is a modification one. This here rule is mainly important in all rules because it determines mainly the classification universally. That's why you should go through it in detail. You should remember this rule very properly. That is, most posterior edentulous area always determines the classification. Then coming to rule number 6, that is the edentulous areas uh, other than those determining the classification are referred to as the modification area. Here you can see the edentulous areas other than those determining the classification. That is the this is the edentulous area. Here in this diagram you can see these are the other edentulous areas. The edentulous area other than the determining classification. That is, this is the determining classification edentulous area, and these are the other edentulous area which comes as a or which referred as a modification areas. Here you can classify this diagram as a class Kennedy's class 2 modification 2, as there are two modifications area seen here, and this is the most posterior edentulous area. That's why it determines the classification. Now coming to rule number 7, this is also important rule in which the extent of the modification is not considered. That means one tooth is missing, two teeth is missing, or three teeth are missing. It's not considered. Only the number of additional edentulous areas is considered. Here you can see here. This is also one edentulous area. That is one modification. This is also one modification. As here are three teeth are missing, but it comes as a only one modification area, not a one, two, three. This also comes as a one modification. Class 2 modification 1. In this diagram also class 2 modification 1. Coming to rule number 8. Kennedy class 4 has a no modification. Now this is the really challenging rule. Actually, we should know why this is Kennedy's class 4 has a no modification. Just we saw the 7th rule. According to that, we should come to know the exact point why there is no modification area for class 4. The reason is mainly, as we know, the class 4 is the single but bilateral edentulous area present anteriorly and posterior to teeth are present. This is the class 4 mainly. But as we have seen rule number 5, after let's rule number 5, they stated that most posterior area, that means any posterior edentulous area determines the classification in Kennedy's class 4. That's why Kennedy's class 4 has a no modification. As in this diagram, uh, if this is the edentulous area, then it becomes the modification because most posterior is this. Most posterior edentulous space is this area. That's why it determines the classification. That is the anterior and posterior teeth are present. That's why this is the classification 3, and this comes under the modification 1. That's why this classification is Kennedy's class 3 modification 1. As Kennedy's class 4 has no modifications. Remember, Kennedy's class 4 has a no any modifications. Again, we will revise once these rules. Classification should follow rather than precede any extraction. That means the extraction should be done previously. After that, classification is decided. Then rule number two, if third molar is missing and not to be replaced, it is not considered in the classification. Rule number three, if third molar is present and is to be used as an abutment, then it is considered in the classification. Rule number five, if the second molar is missing and not to be replaced, it is not considered in the classification. Rule number five, the most posterior edentulous area always determines the classification. The edentulous areas other than those determining the classification are referred to as a modification area. Rule number seven, the extent of the modification is not considered, only the number of additional edentulous areas are considered. Rule number eight is a Kennedy's class 4 as a normal. These are the mainly eight important rules of the appellates we have seen. Now, here in this diagram, it is actually exercise for you. Uh, in this first diagram, you can tell me which is the classification of this. What is the classification of this diagram? Same like A, B, C, D, E, F, G, H. That means there are nine caste are given. Just you have to classify this caste. Actually, we will see one by one. That is in A. Here you can see single edentulous area crossing the midline. That's why it comes under classification 4. Kennedy's classification 4. Here you can see here most posterior edentulous area is this. These are the modification. That's why it is a single unilateral edentulous area. That's why it comes under the class 2. Kennedy's class 2 modification 1 and 2. Kennedy's class 2 modification 1 and 2 means Kennedy's class 2 modification 2. In this third diagram you can see most posterior edentulous area. Here you can see most posterior. Both sides there is a edentulous area which is the most posterior. That's why it is a Kennedy's class 1 with modification 1. In this diagram you can see Kennedy's class 1 modification 1. In fourth diagram you can see here is edentulous area, here also edentulous area, here. But the most posterior, that means here you can see most posterior Kennedy's class 3 modification 1, 2, 3. Kennedy's class 3 modification 3. In this diagram there is here edentulous space is present, here edentulous space is present. But most posterior means it comes anteriorly present, posteriorly. So it comes under Kennedy's class 3 modification 1. Here in this diagram, bilaterally second molar is missing. That's why bilateral edentulous area. That means Kennedy's class 1 modification 1 and 2. Two modification. Kennedy's class 1 modification 2. In this diagram, here you can see single bilateral crossing the midline. That's why it comes Kennedy's class 4. Here you can see the central incisor is present here. The opposite quadrant central incisor is absent. That means it doesn't cross the midline. And here, not a single teeth is present in this side. That's why it is a single bilateral item. Single, it's a single edentulous area. That's why it's comes under classification 2. It is classification 2. Here you can see the most edentulous area is here. That's why it comes Kennedy's class 2 modification 8, 1, 2, 3, 4, 5, 6, 7. That's why it is Kennedy's class 2 modification 7. This is just for a example and just for your knowledge purpose. Coming to summary, classification of the partially edentulous dental arches, as we have seen the classification of the partially edentulous arches. Then requirements of the acceptable classification. Then we saw various systems of the classification. Then the main important system, that is the Kennedy's classification. saw it in detail. Then we saw the most important part for uh, the universal acceptance of the kinesis classification, that is the Applegate's rules. There are 8 rules. We saw that rules one by one. This is the summary part, and here comes the references. Now, just to go through this topic in detail, because this, if you understand about the classification and introduction part of the node partial density, other part will be very easy to understand. Make it clear. Thank you. The remaining part will be covered in the next lecture. The next topic, that is direct analysis.